I don't know how it works, but I think that when your intent is to help someone and to be there for them, these coincidences occur more commonly. It's not. I don't think it's always a conscious thing that you want to make this happen. It just happens because it's congruent with what your intent is. My purpose is, I think I made as an oversimplification. I just want to help people. I want to help them, with their health and just help them enjoy what they're going through as much as possible. And then that tends to create those kind of synchronicities. I've thought about this a lot too. It really is a form of empathy. And I mean, synchronicities can be a form of empathy. And for any providers watching this talk, a lot of people will say, well, what's the big deal? It doesn't help with my quality of care. It doesn't meet different criteria that I want to spend my time with. I'm going to spend my time with this computerized record. Well, there's actually research with empathy. Now, it's not exactly, I don't know if we could make the jump right over to...
We can, David, and we'll do it. We'll do it after you finish what you're saying. We can make the jump.
Okay.
Welcome to Connecting with Coincidence. I am your host, Bernie Beitman, MD, and yeah, I'm a doctor, like a regular doctor, medical school kind of thing. A lot of people use the word doctor, and who knows, doctor of anything now, because you get a PhD and you call yourself a doctor. Well, this is a medical one that we're talking about today, and we got a real doctor, a real physician, a medical doctor, to talk about synchronicity. They are probably more common in medicine than we realize. And the reason has a lot to do with what makes meaningful coincidence take place. And there are three variables that tend to increase the likelihood if you're paying attention to them. And one of them is high emotion. So when people are going to the doctor, they are usually in a high emotional state. And when they go, they also have a need because there's something that's bothering them and they need some help. So high emotion and need, as well as transition or life stressors, also tend to increase meaningful coincidences, generally speaking, but they also increase them, therefore, when people come in to see their doctor. And we're going to have some stories about that today with our guest, David Cannon. So David Cannon, with a name like Cannon, I mean, this guy is the opposite of a cannon hitting out there. He's one of the nicest guys you'll ever meet. He was originally from West Virginia and went to Duke University for his undergraduate degree in chemistry before going on to get his medical degree also at Duke. He did postgraduate primary care internal medicine at the University of Virginia here in Charlottesville. And following his residency training, he was in the Navy for a couple of years. Then he came back to Lynchburg, Virginia, to join a then small group practice in general internal medicine. And he won't take any responsibility for it, but it has evolved into a large primary care group with several offices serving the community. But the thing that brought us together is that he completed an integrative medicine fellowship at the University of Arizona in 2005, which was organized by Andrew Weil, an old friend of mine. And it was so nice to connect with a guy that knows Andy and went to his training program. And David Cannon, as you'll see, is a warm-hearted, loving guy who's really likes to connect with his patients. And synchronicity can be a way, meaningful coincidence can be a way for people to connect with each other. So when you get a nice, meaningful coincidence going on between the physician and the patient, that helps strengthen the therapeutic alliance. And we'll hear about some of that, some stories like that from David today. So, David, welcome to Connecting with Coincidence.
Well, thank you. I appreciate the opportunity to spend some time with you. So.
You are, and we will. So why don't you? So why don't you hit us with a coincidence story from your medical practice, David?
Yeah, well, gosh, it's it's hard to pick out particular things because there are so many things. I've been so blessed with having so much of that and helping me in my practice. But so I'll just give one that happened last week, which was happened all the time. Anyway, I saw one of my favorite ladies. She's one of my favorite human beings. She's 99 years old. And just an amazing person. And she came in with a minor uh, respiratory symptom. And I think the family just wanted to be sure that she didn't have something more involved, like COVID or influenza or whatever. So anyway, I took a look at her, examined her. We checked her for those different things. She came out fine. And we were just going to use an antibiotic to help with like a sinus infection. And so case closed. I went on to the next person, and about 2 minutes into that, a staff person ran into my office and said, "Come out to the parking lot." This person tripped and fell in the parking lot and hit her head. And so, anyway, I rushed out, and she didn't faint. She just tripped. She didn't have a stroke or any of those serious things, but it was serious enough that she had a head injury. She had a golf ball sized lump on her forehead. And so she needed to go to the emergency room and have a CT scan to be sure she didn't have a more involved head injury. And so, anyway, we got her situated, and I went on about my business. I went back into the office and didn't really have time to contact any of her family. She was with a caregiver, actually. So anyway, this was the day before Valentine's, and so I I never leave the office before 7:30 at night because of everything that's happening in medical care. But this was the day before Valentine's Day, and I wanted to race over and get some flowers for my wife at a grocery store, which I never get a chance to do that usually. Anyway, I raced over because I had a meeting at 6:30. I raced over to the grocery store, picked out some incredible flowers, raced over to the checkout line, and I looked across the checkout line, and in the next row was the son of my patient that was in the emergency room getting her head scanned. And I've never seen him in that store before. Um, and he didn't know what had happened. So I felt bad about not being able to connect with them. So I told him what happened, and I explained I thought she was going to be okay. But it was a way of helping that situation, um, her family and her, without really having any clue that it was going to happen that way. And that sort of a situation, I think, makes it leaves the family and the patient with the sense that you care about them. I mean, that was totally coincidental, but the fact that I was able to share some really important information about his mother during that situation was pretty valuable, I think. So, and that was last week.
Yeah, that's a wonderful story, especially since you're getting some flowers for your mother. I mean, for your wife,
Yeah,
your
right.
mother, for your wife. It's it's that, and again, you were in transition or moving around a lot,
Hmm.
and that increases probabilities of coincidences. And there, the sun was right there for you to give the information to
Hmm.
without having to make a phone call or track him down or somebody else having to do it. So he was grateful that you could tell him what had happened. How did it make you feel, David?
I felt wonderful because again, she, as I said, she's one of my favorite people. Um, and you know, you know, unknowingly to patients, you care about what happens to them a lot of times. I mean, sometimes they have the sense that, no, they didn't care. But when they do get that sense, which is genuine, it has a healing energy with it. And I think it actually can help, you know, facilitate moving through a difficult situation. So,
Yeah,
yeah.
what you're talking about is the sense of being cared for,
Hmm.
that not only the patient can have, but also the family can have by your having come in with information at the right time to the right person, so that augments the, let me say, love in the system,
Hmm.
uh, the
Hmm.
caring in the system.
Yeah.
And just to make that yet clearer, for those people just meeting you, you are among the most caring kinds of physicians that people can run into. You can't help it. You can't help it. That's what you do. Uh, you care, and
Yeah.
it's a wonderful thing about you. And this kind of was an amplifier where you were also trying to be able to show you cared about your wife. So you got a double hit there, the
Yeah. Yeah.
flowers, and you showed you care to the son.
Right. Yeah. Yeah. Yeah, and I think those sorts of things make it fun too. More fun to practice. It's kind of like an adventure in a way sometimes, you know, which which is really then that's another aspect of medical care. I mean, as you mentioned earlier in the introduction, a lot of times there's crisis going on. It can be a very stressful environment, and I think um, humor and other ways of sharing with each other caregivers, can make it easier to be in a positive frame of mind for your patients. And I think that's pretty important because maybe even more so now than it used to be because of all the stresses with COVID and all kinds of and the shrinking of the medical system in a sense, making it harder for people to get appointments and getting their needs met. It can be pretty stressful for the staff. So I think the synchronicities really helped me a lot with that aspect of it. So,
Help you a lot to help your patients. I
right.
think you're being able to say, help
Yeah.
you a lot to help your patients, and
Right.
you end up having a reciprocal experience that is
Hmm.
beneficial for both of you. And you
Right.
didn't mention, but I will. But in this the changes in medicine that have gotten more technological and more report oriented, so that you have to fill out the electronic medical record, and miss being involved with the patient. And this is a kind of an accelerated way for David Cannon to do what he does best, among other things, is connect with patients. And that's what you like to be able to do. And you
Yeah.
have that. Now, I think you have some other stories that are like that, if I am correct.
Yeah. I'm a couple. Well, one, I have a patient who's about almost to retirement age. He's kind of a laborer type guy, just a salt of the earth person. I mean, just a really interesting guy. He's smoked a long time and has chronic obstructive lung disease, and he is still fairly functional. But he's frustrated that he's not able to do a lot of the things that he wants to do because of his lung problem. So I saw him several weeks ago, and he sees pulmonary specialists here in Lynchburg, and he had just seen a very good pulmonologist, and who had told him, "Well, I'm sorry, there's just nothing else that um, I no, you can do, we're doing what we can, but that's about it. Sorry. And so that, again, that's an honest answer. It wasn't a criticism or anything. But that was the reply from his pulmonary physician. So here I am seeing him about 2 or 3 weeks later. And what I was thinking, as he was recounting this, I was thinking about some alternative approaches that I had heard about uh, with lung disease. And there's a technique where you use oil of frankincense, which is an older remedy that used to be used for lots of different medical issues. But it's when you breathe in um, the the scent from the oil, it has an anti-inflammatory effect in the lung. It actually does. It's not like a potent pharmaceutical, but it does have a tendency to reduce inflammation in the lung, and it has been shown to help people with chronic lung problems. So I'm sitting here in my office or with this patient, and I was thinking uh, to myself, do I dare say anything about this? Because this guy will probably think I'm nuts, uh, talking about breathing in frankincense. But I thought, well, you know, I don't really have anything else to offer him, and that could be helpful. So I'm going to go ahead and mention it. So I started to talk to him about this oil of frankincense and aerosol therapy, and his eyes started getting bigger and bigger. And he said, "You know, I just saw an article on the computer 2 or 3 days ago, and I was wondering about asking you about it, but I was afraid to because he'd think I was stupid." So, so there we were. And actually, he didn't use it a lot, but he tried it some. But um, I think there it's not so much the oil of frankincense; it's the connectivity that he felt like, well, somebody was thinking about him and cared about him, and he had the same notion. And bingo, we both, and that's a pretty unusual thing to think about. So there's got to be something. That's a real coincidence that both of us would have come up with that idea in that setting. So,
Yeah, that's you call it we call that a real coincidence. I would call it a real coincidence too. I might even hesitate to call it a meaningful coincidence, uh,
wow.
which it
Yeah.
is. It was meaningful to both of you.
Hmm.
Now you just I mean they happen to you, and it's just worth mentioning again that you are a very interpersonal guy, a very loving guy, and so you're of a kind of person who has a kind of synchronicity that he likes to have happen, the ones that make the relationship stronger.
Yeah. Mhm.
That's and there's like a kind of a fingerprint of synchronicity types for some people that this is what they like. That's what they resonate with. These are the kinds of things that you do because this one's a great one. Uh, all you need is some frankincense and what, myrrh,
Yeah.
Myrrh,
Yeah. Hmm.
and, and
Yeah.
some donkey and some people having a baby. Uh,
Yeah.
and
Oh, yeah. Boy.
you got the whole thing going on right
Yeah.
there.
There we go. Yeah. Well, now I got a couple other ones like that. But the other thing I was going to mention when I got to thinking about this talk with you, we all coincidence or the synchronicities for me are almost always positive. I mean, that they're very beneficial things. But some people have coincidences that are not positive, that are
Yeah,
negative things.
yeah.
And one thing I've learned over the years um, is that a lot of times when there's a slip up or a mix up on something like a prescription or whatever, I'm not talking about malpractice, but I'm just saying there's some thing that happened that the patient didn't like. Very frequently, I finally saw patterns to that a lot of times the patient there was actually a lack of trust on the part of the patient. The patient expected a problem to occur, and then it did occur. And it was it's a clue to me. It's a clue when there are um, slip ups like that, that there may be an issue with the relationship with the patient. It's not always just some technical thing that it may have actually been created in a sense. And that's actually maybe even more common than it used to be, because our system is in some ways struggling with the staffing is short, the number of providers is shorter, and so the patients are waiting longer for their appointments, and waiting longer to have things done, and it's frustrating for them. Their needs are not being met basically, and so these slip ups, I just watch to see where they happen, and frequently there can be a trust issue with the patient, and that's not a good setting to work in. So if I can identify things like that and then try to talk through them with the patient or work through them, then it can sometimes sort of nullify that lack of trust issue that's present.
It seems that you are saying that if you, as a patient, are expecting something that will increase your lack of trust or decrease your trust, the system is so ready to mess up
Yeah.
that it responds to the patient, maybe the patient's belief that something will
Yeah.
happen that's negative.
Yeah. Yeah, I think, and I guess that's kind of been an evolutionary, well, not that specific thing, a trend, but I think in the past, the doctor patient relationship was very personal. And as you mentioned a little bit ago, we've gotten more and more computer oriented. And there's a lot of time spent on sitting there with your computer and documenting, all these little I's and T's crossed and everything in the record. And the patient is sitting over there not even being looked at. And that's a big concern. That's one of my big concerns with trying to not have my relationships that way, because in a way that's a barrier between the communication between patient and physician. And so I really do focus a good bit on empathy with the patient, which is the way it used to be. It used to be that there was maybe more empathy than technical procedures and pharmaceuticals and all this. But I'm not sure all that's a lot better than the empathy piece, as far as helping people work through crises and medical problems and medical issues. So I spend a lot of time with my fellows that I'm mentoring in the fellowship, integrated medicine fellowship, talking about that empathy piece. And I've seen in recent times where I'll see a patient and they saw another doctor somewhere, and the doctor never touched me. He never looked at me. And I understand why that is. It's not necessarily just a criticism. It's an observation. Yeah, he or she was there, intently filling out the medical record form that needed to be done, and that he only had 5 or 6 minutes with the patient, and unfortunately, it's a little challenging to be real empathetic in a setting like that. So.
Very challenging to be empathetic in a setting like that when you're not even looking at the person.
Well,
Uh,
yeah,
you can be empathetic with the electronic medical record, maybe, but not with the patient,
yeah,
and that's an inhibition. Um,
yeah.
I wonder if you have any specific examples about the patient having some kind of sense that things are going to go wrong or a lack of trust, and then something happens that is something that goes wrong? You talked rather generally about that. See if you can remember something that's more specific.
Um, well, yeah, I have one lady I'm following. I followed her for years, and um, she has developed some memory issues and dementia issues, uh, potentially, just along with some physical things that she had to cope with, some surgery. And so a lot of times that's challenging in the post-operative period. It's very challenging to, you know, get the therapy set up properly and make sure all the medications are being given correctly and that there aren't any complicated factors like infection or anything post-operatively. And so um, sometimes the family members, especially with this cognitive issue, uh, with mental status issues and forgetfulness and those sorts of things, they are they want something that works really quickly, that you can make a diagnosis and fix it. Well, that's not the way it works with that situation. And so a lot of times in that setting, you're already in a position where they're going to be unhappy with what you're doing. But and then they can interpret, um, like starting an antibiotic for a urinary tract infection. Sometimes you don't know right away what the bacteria is. So we usually empirically start with the likely proper choice, and then we get a culture result, and that takes 2 days to come back. And then at the end of that 2 days, we can, um, we can change the antibiotic if necessary. Well, and sometimes you do have to make that change. Well, in a setting like that, a lot of times the the patient and family will say, "Well, he did the wrong thing. He gave me the wrong antibiotic," and they will interpret that as poor practice. And it's it's what we have to work with now. But it's things like that that can make it challenging, to follow the protocols and not fix something right away, which is what the patient and family and what I want too. But it's
Well, what I was asking about is that a negative view of the treatment, like what if he's giving the wrong antibiotic, turns
mhm,
out to be accurate, that it was the wrong antibiotic. And so because the culture shows it needs a different antibiotic to treat this infection.
yeah,
So and that confirms if and when that happens, that confirms the family's belief that you're not
yeah,
treating the person right. I suppose that's
right.
happened.
Oh yeah, it does. But it's also standard protocol, because the other option would be to wait 2 days, until the culture comes back, and then the person can get really sick in the meantime.
Yeah, yeah,
Uh,
yeah. You're following the standard protocol where
yeah,
the real problem is it takes 2 days to get the results back.
yeah, yeah,
When if you had the laboratory next door, I mean, you usually can find out. Well, it's got to grow something, so that takes a little while. But you
yeah,
also can
yeah,
look under a microscope sometimes and identify the bacteria in there because they look a little different. But
yeah,
they don't do that. They want to be sure and have a culture grown so that
yeah,
there's going to be a definitive result for you. So, given the way bacteria don't grow instantly on petri dishes, you've got to be able to wait. And I'm thinking that if you gave the wrong antibiotic, as shown by the 2 days later result, and the person may have gotten worse, sometimes antibiotics that are wrong still help a little bit,
hmm
that that decreases their trust in you, and that's going to end up making the treatment outcome more negative.
yeah, yeah.
Is that
That's
right?
possible. Yeah, it can be possible. Yeah.
What are we telling our people who are, all of us are prospective patients, if we're not already? What are we telling our audience now, David?
I don't know. I guess that it's challenging sometimes. Even when you do the right thing, it doesn't always work exactly the way you wanted it to. And I think I try to share that with patients too. And rather than become defensive about it, I usually try to, again, back to empathy. I try to empathize with where they are about, you know, what what their feeling is and how they, rather than my perspective on it. Because I think a lot of times when you connect at that level, they they actually are a little bit more understanding about it. And in fact, a lot that the example I just gave was more of a like a physical infection with an antibiotic treatment. But when I hear patients complain about the system or the care, I frequently agree with them. I don't say I can fix it, but I frequently see where they're coming from, and I actually agree with them. And so rather than being defensive, a lot of times I try to empathize with where they are, and sometimes that can be helpful in helping them cope with the outcome that they didn't want, you know.
Well, you're not trying to defend a system that is continuously getting broken,
Right,
and
right.
it's not effective, and so you're empathizing with them. And
Mhm.
one of the things that you've told me, David, is that um, sometimes providers, doctors, nurses, um, can create synchronicities with their patients, can create them. Could you tell us about that?
Um, you know, I think a lot of that, I don't know how it works, but I think that when your intent is to help someone and to be there for them, these coincidences occur more commonly. And again, like that grocery store thing. I had no thought about the lady that had the head injury when I was bustling through all that. But what got created was something that was a connection with the family and in a sense with the patient. And so it's not. I don't think it's always a conscious thing that you want to make this happen. It just happens because it's congruent with what your intent is. And in yeah, my purpose is, I think I made as an oversimplification. I just want to help people. I want to help them, with their health and just help them enjoy what they're going through as much as possible. And then that tends to create those kind of synchronicities, which are more positive things. And again, they're kind of like that frankincense thing. It's just kind of funny, or that it happened that way. Um, but but I think it does. And actually, I've thought about this a lot too. It really is a form of empathy, and I mean, synchronicities can be a form of empathy. And for any providers watching this talk, um, a lot of people say, well, what's the big deal? It doesn't help with my quality of care. It doesn't meet different criteria that I want to spend my time with. I'm going to spend my time with this computerized record. Well, there's actually research with empathy. Now, it's not exactly. I don't know if we could make the jump right over to.
We can, David, and we'll do it. We'll do it after you finish what you're saying. We can make
Okay,
the jump.
okay. Well, there are three things that three or four things in the research about empathy, and well, one interesting, fascinating paper I saw was on back pain. I almost didn't read it, but it was a synchronicity that I read it because the title of the article was what two things help chronic back pain? Well, and I see back pain all the time, every day, and so there are all these narcotics, injections. Anyway, this was a Cochrane review. It's a large review of thousands of patients. I think there were 24,000 patients in this review, and the two things that tend to help chronic back pain, one is exercise, movement, and the other is empathy of the provider. Now, if you would ask most people, and this is a scientific review of literature to 24,000 patients. I mean, it's not just somebody's little, idea. It's data that actually show that really makes a difference with a chronic problem. And so that was one specific thing, but there are three or four other areas where they looked at that when I talk to my fellows about, well, why is it important to take the time to be empathetic with your patients? They have shown increased compliance with instructions. And that's a big deal right now with Medicare. We get all kinds of harassment when patients don't fill their medicines and don't take their drugs. And then we get dinged because they're not doing that, and it's not good quality of care. And by the way, as a parenthetic thing, we gave them 7 pages of scary threats about what bad things the medicine can do and expect them to take it. I mean, come on, really. Anyway, so so there are all these compliance measures, and actually empathy is one of the things that increases compliance in the patient following your instructions. And so for the hardcore, traditional docs, I like to make that point. If they really want, there's something other than your computer, electronic medical record that may be able to help you there. The other thing, there's a decrease in malpractice. If you actually take, your patient's complaints seriously and don't defend don't get defensive, just try to empathize with them, that actually reduces the incidence of malpractice suits for them. And then,
that's an important point for the physician. How is that relevant to the patient?
well, it's not. That was really geared more for any provider.
It's not, yet it's an important thing to note that the happy patient is less likely to do malpractice, just as the happy patient, the empathically received patient, is more likely to be able to do what you ask them to do, is take the pills
Sure.
or go to rehab or something. So that when there's a positive relationship, and this has been shown in psychotherapy research, the strength of the therapeutic alliance sometimes is the strongest correlate with outcome compared to anything else, no matter what you do.
Exactly.
No matter what you do, you are emphasizing that if you have a good relationship, then that is a good thing for the outcome of the patient, no matter what you're doing, no matter what kind of medicine you're practicing.
Well, that dovetails into a whole huge other area, but
well, let's come back. Let's come back to the idea of synchronicity and empathy, because you were a little kind of hesitant of making the connection between them, and I'm going to make you less hesitant right now, Dr. Cannon, and this will be part of our fellowship discussion right now, just with you and me.
Yeah. Well, the other thing before you get into yours, let me tell you the other thing. The other thing of research is that there's less provider burnout with people that practice that way. And that's a big issue now. That's part of why our system is shrinking, because the providers are burning out. They've had it. They're done. They can't keep doing it. And so anything that there are all kinds of now strategies, different ways to help reduce provider burnout, but this is one of them. And see, I think synchronicity is too. I think it's a way to reduce provider burnout. It's not advertised that way, but empathy has been looked at and has showed that. And I think synchronicity is probably the same thing.
How do you think synchronicity helps with provider burnout?
Well, because it's interesting, wow, what am I going to create today that I didn't have a clue about, or where am I going to get this uh, idea that where did I find this idea, get this intuitive idea to try this with this patient, and a lot of times I think there are like you said, like dreams or different thoughts or different stimuli that will make you think of sometimes seeing an animal that's limping along with a hip problem will make me think of somebody that's just had a hip replacement. And maybe if I give them a treat, that'll get better. Like if you give the dog a treat. No, that's not very uh, scientific. But I think really a lot of times, another, again, there's another synchronicity that I've heard other people say, and it used to kind of surprise me, but within, uh, when I would think of somebody, like where I have a thought of their name, I'd see a name in a newspaper and it wasn't that person, but it was their last name. I would think about that person, and it's usually within 24 hours, I would get a call from that person. And I've heard other fellows talk about that when they think about somebody, something triggers their thought about someone, and within a day, there's something that they need to help that person with.
And that does something to you because it's an adventure. Uh,
Yeah,
if you're curious and looking and willing to make matches between the environment you're in and something else like what a patient comes in with, if you're willing to do the matches, which you are, and that's what you have to be able to do. The beginning of synchronicity is being willing to see them, and you
yeah,
are not only willing to see them, you look for them because they're a lot of fun,
yeah.
they're
Mm-hmm.
funny,
Mm-hmm.
and they help connect you and the patient.
Mm-hmm. Yeah.
Now, I can talk now if you want, or you can, about how synchronicities, particularly the one with the frankincense and the one with the son whose mother got the goose egg on her head,
Yeah.
how those two help with the therapeutic alliance.
Yeah. No, go for it.
You're very much tuned to empathy. David Cannon's middle name is Empathy. DEC, David Empathy Cannon. It's just how you've been manufactured out there in the hills of West Virginia.
Yeah.
That's what you do. So just imagine, and you can, it's so easy for you right when I mention it, that your empathy is recognizing the experience of the other person, emotionally, cognitive, or both, and saying that you recognize their emotional, cognitive experience. That's empathy.
Yeah.
So here comes Dr. David Cannon come and says frankincense to a guy who has just thought about frankincense. So that's empathy because you are saying what he has been thinking about.
Mhm.
And you're having the courage to say it against your best medical, usual, standard ways of thinking. And he's afraid to bring it up to you. And you have the courage not only to say it, but say what is also on his mind.
Mhm.
That's empathy to me, David.
Yeah.
No?
Yeah. No, and I think I see that helps the person too. It empowers them,
Oh, it
with their
empowers
healing.
him, but I'm just talking about how you become a mind reader.
Yeah. Yeah. I
You
guess.
be you got to stop being so conventional right now.
Okay.
Um, you because there's more to all this than you're allowing yourself to think
Yeah.
about. And that's what
Yeah.
I'm just running into. I mean,
Yeah.
you're still just caught up in conventional medicine because I've
Hmm.
just knocked on the door of the rigidity of your ways of thinking about how these
Yeah.
things happen. I just,
Yeah.
I hurt my head. I got a goosebump, right? I mean, I got a thing right there. I hurt my, I got hurt right there.
Mhm.
If, if, if I say to you, as if you're the patient, I know that you just read in the paper about frankincense a couple of days ago. And I just happen to have thought about frankincense myself as something that might be useful to you. So, what do you think? Isn't
Yeah.
that what you do when you're being direct empathy? You're kind of
Yeah.
bringing up something that. So, how does it happen? That's your problem. You say,
Yeah. Right.
well, your problem is how does that happen? Well, how does that happen becomes my question because, of course, that's what I'm studying, and you kind of know that. This is a kind of simple one, really. It shows how interconnected human minds are,
Yeah. Hmm.
and how you guys in medicine still tend to think of the body as separate from its environment, even though you know it
Yeah.
isn't.
Hmm.
Tend to think this is a robot with machine-like qualities, and I'm going to just turn the screw on this thing, and it's going to be better. What
Yeah.
medicine has not yet recognized enough, and you not either, even though you know what I'm saying, is that you and the patient are part of a field. You and the patient are much more connected. So when there is a desire, an intention on your part to heal, you're somehow, and the somehow we're not going to try to get into, led to a place that the patient is also being led to by his own need for looking around for stuff. And this fits under a general category with what you're looking for is looking for you.
Hmm.
What you're looking for is looking for you. It's sometimes called like attracts like. I like the energy that comes with the looking for. The
Hmm.
both of you were looking for something and you both found something. And how that operates is another question, but it has to do with the interconnectedness that you establish. You, David Cannon, establish with your patients because you connect with them. And for you to think that when you go home, you're not connected with them anymore is your choice.
Yeah.
You go ahead and do that. But I'm sorry, you're part of a little group of interconnected people called your patients. Your 99-year-old woman, you really care about her. You like her. You know their family, her family
Hmm.
members. And
Hmm.
you're in a kind of a small town, so that kind of stuff happens. So you're in a web
Yeah.
of interrelationships. And the web is what you are just discovering and kind of don't want to because medicine tells you you can't think like this. But
Hmm.
your experiences are telling you something different. What do you think of that one, David?
Oh, I think you're right on. I mean, I think it's exactly right. And I guess, you know, I, I think our consciousness and our abilities are far beyond what we have any notion of. But the more we can discover those things, the more we can empower some of those abilities to do good things. So,
And David, I am in your life to empower you more.
yeah.
Can you let yourself be? It's like you don't know why, but I'm telling you why. Uh, you have the power to heal that comes directly from your desire, your intention to heal, David. You
Mhm.
care. You have a big heart. It gets stomped on sometimes. I know that. You get hurt by people that you care about. That happens to you. But you learn to be able to manage
Yeah.
those
Hmm.
possibilities so that you're caring in a safer environment, which you've learned over the years. You're caring connects you.
Mhm.
Synchronicity is kind of like phenolphthalein putting into an acid-base mixture and it shows up a different color or a color. Your synchronicities are like markers of your web-like connections to
Mhm.
multiple people in your life, especially your patients.
Yeah. Mhm. No, I think I totally see that. Um, you
Well,
know,
you didn't see it before. Now that you're seeing it, what is that like? That's what I want to know.
well, I guess I should say I see it, but I don't pay attention to it. Well,
Oh
because
yeah,
I'm
yeah,
busy.
good, good. Go
I'm
ahead.
busy doing stuff,
Yeah.
all these other things. But I know I've felt for a long time that we're a lot more connected than we're not really just separate individuals. We're all together, all connected.
And
So,
connected in different intensities. And what
yeah,
I'm saying is that I'm not saying you don't know this, but you didn't know it enough to be able to say it to me.
yeah, yeah. Okay, yeah,
And so I'm making the subconscious conscious here.
yeah,
You 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 kind of knew it, now you know it. So that when you bought the special flowers for your wife before Valentine's Day, your heart was wide open to help, to be positive,
mm-hmm,
and you found your way to another member of your web because
hmm,
people are webbed with different intensities, and
hmm,
those intensities vary over time. So you popped up your connection with the son by, even if it wasn't conscious, by being concerned about his mother and wanting him to know what was going on with her. That
yeah,
I'll
yeah,
call that subconscious, not an intention, but it was there's so
hmm,
much that goes on subconsciously, and this is a manifestation of a subconscious intention of not just you. I hope you keep in mind after we're finished with this, where you are seeking is seeking you. You didn't know you were seeking the sun. He didn't know he was seeking you, but in the web of interconnectedness, you really needed to talk with each other.
hmm, hmm,
And it doesn't happen all the time, but the probabilities worked out so that you actually made a connection to a person with whom you could deliver important information in an empathic way that served your relationship not just to him, but also to her family.
hmm, yeah,
It's beautiful.
mhm, yeah. I guess too. Um, I'm sometimes a lot of times I'm aware of these. I mean, some parts of this, but
Yeah,
I don't focus on it a lot. Uh,
you're too
again,
busy. You're too busy.
yeah,
You can't. But you are what we call a doctor, a physician, and as a physician, you're curious about how things work.
hmm,
And this is a place where you're able to have enough freedom of thought to open your mind up to what you kind of already know so that I can help you articulate
right, hmm,
what you already know.
right, yeah.
And why is that useful for you?
Well, because it makes me more effective. It keeps me more on my real purpose. Um, so and it's practice, I guess.
It's
You know.
practice. Yeah, it's
Yeah.
practice.
Hmm. So that's
Well,
that's what they say.
I, the practice of medicine. This
Yeah.
is part of it. And I'm hoping that with your fellows, you come away from this discussion, and maybe some of your colleagues too, and even some of your patients, you come away with all of them knowing that the interconnectedness can manifest in terms of meaningful coincidences like the
Hmm.
ones you've reported.
Yeah. Hmm.
And that helps everybody see the web that we're all part of, which you
Hmm.
know, but you don't know in the way that you've kind of got to know it today.
Yeah. Yeah. No, I think, yeah, it does take more concreteness, I guess,
Yeah,
to,
concreteness. By labeling, it makes it more concrete. Yes.
yeah,
Yeah.
which is helpful, you know. So,
That's what we call a diagnosis, I usually think.
yep.
Putting a name on something.
That's right. Yeah.
It helps. It's
Give it a handle.
give it a handle. Rumpelstiltskin, we won't tell that story, but
Yeah.
that's where the name made a big difference. So we've
Yeah.
come to the end of our time together, and I like the crescendo that we've gotten in here toward the end, where I could try to suggest to you a way of thinking about synchronicities in medical practice that you have in a way that you kind of knew. I'm not saying you didn't, but now have
Yeah.
names for a picture of. You have a
Sure.
picture of,
Right.
and that's
And I hope,
wonderful.
yeah, and I hope to spread this into the fellows, other fellows, because it's so valuable. And I'm really excited about your possible role in teaching us or working with us over time to make this another dimension of our care that we're not using right now as much as we could.
And this is an example from you, not from me,
Hmm.
of you that I've helped you see so that when you deal with fellows, you now have some beginning descriptive terminology
Hmm.
to give them a label for your experience, which can be a
Right.
model for theirs. And I think that's
Hmm.
marvelous.
Yeah. Well, it's really fun to work with them too, because they're younger and excited, and very stimulated and anxious for all these new perspectives. So it's a great one to add to the other things they're learning. You know.
And you're the ball carrier on this one. Uh, you you got it. Hey, Cannon's got the ball. Is he going to make a shot or not? Okay, uh, we'll see.
Three
But he's
pointer.
a three-pointer. Okay, well that's what you got. You got the opportunity. You can make a couple of three-pointers here,
Yeah.
David. So I hope you do. So thank you very much for talking with me today. It's been a great pleasure.
Well, thank you. I appreciate your presence and your wisdom. So.
Thank you.